you for what you want to make and create for your own journey. But I want to get to know you all a little bit better. And so I'm curious to know, like, whether you just started in the program or you've been here a while, or you've been talking to the year threes, or you've been listening to your clinical educators, who's interested in presenting? Yeah, like at state or national conference, or like in services.
Anytime in the future?
Yeah, anytime in the future. Like you sort of like, you're like, yeah, I totally, like, I'm all over that. So, that's good, everyone's going to do that. How about taking students? Oh, yeah, look at that. So you guys are like on it. How about sort of like identifying the area of practice that you're like, yeah, this is what I'm really good at? Yeah, you might, like one day, you don't know. How about publishing? Could be a manuscript, could be a chapter in a book, could be a book, could be any, like, research. Yeah, good. So, like, I don't know, 30 of you. That's awesome. How about doing private practice, consulting? Look at that. Sweet. Everything. All right, research. Yeah, okay for you. That's pretty good. I keep threes. I think that's really good. How about teaching or being doing administration and hiring? Totally, maybe. Yeah. You're like, I'll leave that door open. And then international OT practice. That's good. So, of all the things up there, and I tell you this, of all the things up there, that has also been my journey, but I didn't know that was going to be my journey. And I didn't know when I was a student, except for the teaching piece, any other thing that I wanted to do. Like, I wasn't very, like, thoughtful about what my journey was going to be like in OT. I was like, I don't know, I think I'm going to be good at OT. I think I'll be a good OT, and then I'll just make it up as I go along. And it's worked out great for me, and that could work out great for you. But when I thought about coming to talk to you today, I'm like, if I could do it all over again, maybe I would have been more thoughtful about the journey I wanted to take, so I could feel more confident about what I wanted to go into. And so you will create your own journey, and you'll have your own path, and there shouldn't be right now any anxiety about what you have to do or what you'll end up doing, because some of it will just be that door opens and you'll be like, yep, I'm going to walk through that. But the fact that you guys are already thinking about things that you would like to do as a professional, I think is super awesome. So there are lots of people out there that want to be mentors and want to encourage you. So as a start, the best advice I could give, number one, is like, find someone who can help nurture you. So you don't have to figure it all out on your own. So you don't have to like be like, well, I don't know this journey, but I'll just pull myself up on my bootstraps and try to make it work, right? So the other thing I want to tell you is wherever I am, it took me 27 years to get there. So I've been an OT for 27 years, and I only tell you that so you can think, she is as old as dirt. It took me a long time. Like all of these things that I've done that I'm like, oh, that was good. I'm happy about that. It took me a long time to get there. And your journey may not take you that long. Or it might be you do your journey for a little while and you contribute to the OT profession, and then you take a break and then you come back to it, right? It'll just be yours. All right, next slide. So my first lesson I wanted to share with you for myself that I felt was really important was really learning from all the people that you will meet that are other healthcare practitioners or other practitioners in general and aren't just OTs. Because I've learned a lot from OTs. Like when I had my first job in rehabilitation in acute rehab in Dallas, I worked with some really fantastic OTs. Like I looked at them and I was like, that's what I want to be like. I want to have their skills. I want to know what they know. But I equally learned from the physical therapists, from the physicians, from the nurses. And so I think it's important just to stay open that you are going to, like once you're done with the program, like your sponginess really begins, right? And so you're trying to absorb all you can from all the different interactions you have and the different people that you meet. I was maybe practicing for about a year, and a fellow physical therapist was like, how about doing a presentation to a bunch of nursing staff on OT and trauma, because I'm going to speak to PT and trauma and what we do in rehab. And I'm like, I don't know that I know enough about OT and trauma. And not sure I can really do it. But Terry Lewis, the PT, was so positive and she was so easygoing. And she only had 2 years experience, so I was like, all right, she's not that much more, doesn't have that much more practice experience than me. So I said yes, and it was great. Like the nursing faculty and staff and the people that we presented to were super open, and we had a great time. And that really opened the door for me to say, okay, yes, I can do it. And so it was easier than to say, yes, I will do this in service, or yes, I will try to present at the Texas State Conference, or I will apply to present to AOTA, and then just take that next step. So I would just encourage you, learn as much as you can from others, and then even if you're not quite sure you're ready, like, I don't know, just challenge yourself and do it. Say yes. Okay, next slide. Step outside your comfort zone so you can develop new skills and interests and really increase your understanding of other people's occupations. So when I was a new practitioner in rehab, they rotated you through the different services. So you would serve on the spinal cord injury group for 6 months, and then you would rotate to stroke, and then you rotate to TBI, and then you rotate to ortho, and then you'd start all over again. And then eventually you'd be like, this is what I really love. I really love working with individuals after traumatic brain injury, so that's what I'm going to focus on. But at the same time, lots of other therapists that I worked with at the different sites, because Baylor had their inpatient rehab, but they also had acute care, and they had outpatient, they had work hardening, and they had aquatics. So because the majority of the profession still remains women, a lot of women go on maternity leave, fellow OTs, and so I just would be like, I'll cover your maternity leave for 3 months. So I'll do outpatient and see what that's about, or I'll do aquatics, or I'll do work hardening. And that doesn't mean that I had to love it and I felt great about it, but at least I had some experience in a different setting. And I think that helped me just understand people and their occupations and what sort of motivates them, drives them. And if I hadn't done aquatics, which I actually really loved, I wouldn't have met my most favorite patient. Her name was Jean, and she had fallen and had a humeral fracture, and it hadn't healed well. It was on her dominant side, and she had sort of developed a sort of a chronic pain condition, wasn't using her hand. And she didn't like the water, but her doctor told her she needed to do a sort of an aquatics therapy program. So she took some swimming lessons, and then she came to therapy. So she was pretty highly motivated, and she loved making these very elaborate dolls where she would they were sort of made out of like ceramic. She would do the hair and all the clothes, and she hadn't been able to do that. The therapy part itself wasn't that exciting. It was good, and she liked it. She got better, but it was like getting to know her as a person and getting to know her like after I was done being her therapist and she was the client, and spending time with her and her husband and finding out more about them. They were just delightful people. And so if I had just stayed in my own little area with rehab and continued to work with individuals with TBI, which is great, and I do love that, I don't know that I would have gotten the richness of what it's like to work with all different kinds of people with all different kinds of conditions and try to understand them better. And I think this also helped me when I decided that when I was in rehab, it was great. I liked it, but I really had always wanted to live overseas. And so I'm like, well, how can I make that happen? So I found a company that placed OTs in other countries where they didn't have enough OTs. So that's how I ended up in England for a year. And so I practiced in the National Health Service at a pretty old hospital in a small little town. And OT practice there is different than it is here in the United States. But again, it just gave me a broader perspective about people and occupations and what makes them tick, and how OT practice can be OT practice, but it can look a little differently depending on your practice site or where you live. And so I would say, if I could do that all over again, I would in a second. And I would encourage you, if you have a passion for that, to figure out how you're going to make that door open. I think it can be really enriching. And when I came back to the States, I'm like, well, we really do have a lot of advantages here. Our practice in some ways was more sophisticated in some areas and maybe less in others, but it just made me understand it and appreciate it better. Volunteer for your state and your national organization, because I think it's important to feel like you are making a contribution to benefit the profession. So when I think back of when I was in OT school all those years ago, my favorite professor, and how she was really like, you are not just a trade. This is a profession, so you have an obligation to give back. So you better figure out how you're going to make that happen. So I had a sort of like very, how do I want to say this? This road was not straight at all. Like it sort of went up and down in all different directions. But I had specialized in dysphagia or disordered swallowing. In the rehab hospital I worked at, OTs did all of that. So we did all the assessments. We did the modified variant swallows. And I had the opportunity to learn fiber optic endoscopic evaluation of swallowing, which is an endoscope that's passed transnasally so you can look over the pharyngeal part of the swallow. So that sort of became my niche for a little while. And I got to work with a speech therapist over in the big hospital. We got to work together. We got trained by someone who had developed this way of evaluating swallowing. And from that, I had called AOTA on a whim because I wanted to find out scope of practice issues. And they didn't really have anything like about scope of practice related to using an invasive instrumentation. But I think when you call into AOTA, they must sort of keep some sort of list behind the scenes. Because about a year later, I got a phone call and asked if I wanted to serve on a committee with some other OTs and an OTA to develop the knowledge and skills paper for feeding, eating, and swallowing. So that was the initial paper that started to say OTs and OTAs have the skills and the knowledge to be able to work with people that have dysphagia, and here's all of the education that they get in school, and here's the extra training they'll need once they're out in the clinic. And so I worked with those OTs and the OTA for maybe a couple of years. And then from that, once you get in with AOTA and they're like, that's a willing participant, they might be willing to volunteer for something else. So a few more years passed, and I got called to see if they'd be willing to be the liaison. They were going to change how they did board certification. And instead of test-based, they were going to open it up to portfolio process for board and specialty certification. And they needed a liaison to coordinate the development of board certification for phys rehab and then specialty certification for feeding, eating, and swallowing. And then I was on another committee, right? And that was like 3 years. Plus then you serve as a reviewer. So that was like another 3 years. And now I'm on a committee that does fellowship development for programs and schools that want to have OT fellows. So I'm just saying, like, say yes, because I think then it opens other doors for you to meet other people, work with other OTs across the nation to do something that benefits the profession. I love being on the fellowship committee because I find out like what's the latest and greatest happening in clinics and in hospitals. I get to travel to their sites and do their site reviews. Just write up a report. That's the least favorite part of that. But the rest of it is actually like really good. And if I hadn't done feeding, eating, and swallowing, and then hadn't done the board and specialty certification, I never would have met Helene Smith Goodbye, and she's the one that wrote the book. She decided she would write an OT book for OT practitioners in acute care. So I never would have met her, and I never would have broken my leg in Canada and called her and said, I can't do my job at the hospital. You got anything going on? And she's like, yeah, I need someone to write a few chapters. And I'm like, okay, I'm interested, right? So you never know, like even when you're like, well, that bad thing happened, something good might come out of it. And so I don't, these were things I never would have thought of as a student or a new graduate that I would have been involved in, but I'm saying you can, and you should think about it. And you should think about like what you might really want to contribute to and how maybe you can meet some people that can make that happen. And then just really caring for OT as a profession in the future. So we need you guys. So you guys are going to be excellent practitioners. You're getting a quality education. You're getting so much hands-on experience. You're going to be great clinical instructors. And we need you. We need you to help care for the future of the profession. So I'm hoping, since all of you raised your hand, that you're like super interested in first being a clinical instructor. And And I love being an instructor. It makes you like pay attention to why you do things. And do you know the latest research? And if you don't, can you find out from the student that you're supervising? So that really helps in that way. And then if you're interested in education, I think in this particular program, think about making that part of your deck somehow. So maybe you're coming to help either like do some lectures or to help create, I don't know, some of the flow, carry out some of the flow in the courses so that you can get your feet wet. We have a deficit of educators that are trained. We don't have enough educators to meet the demand for the OTs that we need to prepare educationally and in practice. We don't have enough OT practitioners to meet the demands of society. We're already behind the ball. So anyone that is interested, there's going to be a place for you at the table. So get some practice now, when it's new and fresh. Don't wait, long time. I mean, you can, but I think as much as you can get your foot in the door early, that will help you. Then you already have that experience. Yeah. So just make a little time for yourself to think about what your dreams are and what you would like to do. It took me a long time to get here. I really love what I do. I really love teaching, even though that's not the majority of my job, what I do. So figure out what your dream is. Figure out what some things you might be interested in. So then you can be conscientiously sort of approaching those. And then stay open to those happy accidents that can sort of pop themselves in your lap. What questions might you have or not? Yeah.
So you mentioned that you did work in England, and you said that there was a need in England for one of OTs. Is there some sort of service that kind of pinpoints where the OT need is, and then they send you, or how did you go about that?
This was a company, and this was back in the late 90s, and so I don't know if that company still does that anymore. The woman that I worked with was like, there's a lack of OTs in England, in the UK, in Ireland, in Australia, but things have changed now. When I went, I was grandfathered in, I didn't have to sit for an exam, and so things have changed, but the World Federation of OT, connected with AOTA, those are really passionate practitioners about OT practice worldwide, and lots of things have opened up now. There's a OT graduate from 2007 who's involved in starting OT practice in the country of Georgia. And she, in the recent version of Lookable Creighton magazine, she's in there. And I feel like the Clin Ed team probably has their finger a little bit more on the pulse about what's going on, where our OT need. But I would say the World Federation of OT would probably have a pretty good idea. I would say there are a lot of volunteer opportunities if you don't want to get paid, right? If you're just I'm going to take my 3 weeks and go to the Dominican Republic, or I'm going to go to Romania or whatever, right, to do my OT practice, or Guatemala. But as far as paid positions, I don't know for now. Sure. Does anyone else have anything to contribute to that, or from the research you've done, for those of you that are interested in international practice?
I've done a lot of looking into volunteerism, and it's super easy to find different places that have actual practicing occupational therapists. But again, I haven't found too much besides telecommunication for different places in different countries. But
I had a friend of mine who's an OT that I worked with at Baylor, and she did a lot of missionary work. So she was an OT in India and Pakistan for a couple of years. Some of that was arranged through the mission work and not through a hospital or whatever. So that might be another option to explore. Yeah.
When you worked at Baylor, were you an interim therapist, or did you work in inpatient and then you just took on for maternity leave?
Yeah, so it was full time, and so I had the most amazing supervisor. She probably was the best supervisor that any OT and young female OT could ever have. And she was really into finding out whatever it was that you wanted to do that you thought would make you a better OT and provide better care. And so she would just be like, all right, we'll pull you from inpatient and someone else will cover your stuff and then you will go cover for maternity. Yeah. Crystal Chance is her name. She just retired last year. It's good to have like really like good mentors wherever you work or a good supervisor, a combination of that. I think that makes a big difference. I think that's why people stayed as long as they did in those early years because she was pretty incredible.
Do you guys have any other questions? Are you good? Dr. Holm, thank you for coming. We wanted to have you come because she is a great mentor. You guys know, you guys will find out. You have experience everywhere under the sun, and it's really great to ask her questions. She knows a little bit of everything, or she'll point you in a direction towards everything. So thank you. We appreciate it.
Yeah, you're welcome. I'm happy. I don't know everything. Mostly I know that I don't know a lot of things. I don't have a lot of resources. And I do know a lot of people. And so if you're like, oh, I'm interested in this, but I am having trouble finding a connection or I need to talk to someone who knows about this, I can't guarantee you 100%, but probably I can come up with an answer for you. So I like to stay curious, right? And I like to learn, right? I like to learn more. So you guys are good because then you'll ask questions and I'll be like, that's a good question. I want to know the answer too. Let's figure it out. Great.
Thank you.
Thank you.